We are here for the Policy and Operations Committee. I call this meeting to order. The first item on our agenda is public comment. Is there anyone that would like to address this committee with public comment?
Good morning. My name is Megan Erskine. I'm the CEO of Catherine's Health Center. We're a community health center here in Kent County, and we serve everybody but specialize in low-income individuals. Today, I would like to talk about H.R. 1 and how it's going to impact residents in Kent County. Kent County has a monthly average of almost 116,000 eligible Medicaid beneficiaries, with almost 38,000 individuals enrolled in the Healthy Michigan Plan. On January 1st, 2027, individuals enrolled in the Healthy Michigan Plan will have to conduct or submit work requirements, and that can be 80 hours a month of work requirements or 80 hours a month of volunteer requirements. This is a huge impact because we know in other states, work requirements do not mean that people have more access to health care. It just means that there's an administrative burden and people lose their health care. This is going to be a huge issue in Kent County as people will lose their health care, lose their health insurance, and there's going to be more uninsured individuals. And when there's more uninsured individuals, we know that costs rise for all residents in Kent County. Hospitals will be dealing with more uncompensated care, and there are going to be huge issues to the social safety net. Our ask today to the commissioners: adopt access to health insurance as a legislative priority of the Board of Commissioners. And what we're asking here is to advocate on behalf of Kent County residents who may lose health insurance coverage, ensuring their needs and concerns are elevated to state and federal decision makers, use county communication channels and a coordinated outreach strategy to increase public awareness of upcoming policy changes, and advocate to MDHHS for funding to support local DHHS offices to process work requirements and redetermination documentation. Low enrollment barriers by strengthening support for organizations that already assist with Medicaid applications and by fostering new opportunities for community engagement. Thank you very much, and we hope that you make this a legislative priority.
Great, thank you. Is there anyone else that'd like to be heard during our public comment? I'm assuming that's a yes. You just have to get your you have to get your utensils to get up here.
This isn't cut into my 3 minutes.
That's right. No.
All right, good morning. Thank you for the opportunity to speak today. My name is Laura Barber. I serve as the Executive Director of the Food Club Network, and I work closely with Community Food Club and reside here in Kent County. I'm also here today to speak about the effects of H.R. 1. Every day at the Community Food Club, we are working alongside families who are doing their best to stay healthy, employed, and stable, but who rely on programs like Medicaid and SNAP to bridge the gap. I am here, like Megan, to urge you to make access to health insurance and SNAP benefits a clear legislative priority for the Board of Commissioners. These programs for these families are not just safety nets. They are economic engines and essential supports for working families. In Kent County alone, more than 73,000 residents rely on SNAP and are at risk of losing benefits. That's 73,000 of our neighbors who are at risk of becoming food insecure and who will need additional support to recertify and keep their benefits. From an economic standpoint, this matters deeply. Every single dollar in SNAP generates about $1.50 in economic activity. These benefits sustain local grocery stores, farmers, and supply chains. In many communities, especially rural areas and food deserts, SNAP can account for up to half of a grocery store's revenue. Cuts to SNAP will not only harm families, they will ripple through our entire local economy. But beyond economics, it's about access and dignity. As policies change and work requirements increase, we will see more residents struggle to navigate these complex systems. That is why it's critical for the county to both advocate at the state and federal level and invest locally. We need coordinated outreach so residents understand these upcoming changes. We need support for local organizations already helping with applications and navigation. And we need to ensure that our local DHHS offices have the resources to process increased workloads efficiently. Kent County has an opportunity to lead here, to protect residents, strengthen our economy, and support community partners who are already doing the work. I ask you, please, to prioritize Medicaid and SNAP access in your recommendations and stand with the thousands of residents, your neighbors, and friends and family who depend on these programs every day. Thank you.
Okay, thank you. See, we have another one. So again, if you can state your name for the committee. Thank you.
Good morning, Chair and members of the board. My name is Amari Fuller. In addition to being a resident of Kent County District 18, I also serve as the Greater Grand Rapids Community Engagement Specialist for the Michigan League for Public Policy. The League is a nonpartisan policy research and advocacy organization that promotes economic opportunity for all and analyzes the impacts of public policy on the lives of Michiganders who have been systemically left out of prosperity. We also serve as the state's Kids Count organization, working as a part of a national effort to measure the well-being of children at the state and local levels. I come to you today in partnership with several organizations who make up the Kent County Medicaid Task Force, asking you to adopt access to health insurance as a legislative priority. We also ask that the board help to lower enrollment barriers by strengthening support for organizations that already assist with Medicaid applications. Significant cuts were made to Medicaid under H.R. 1. As I'm sure many of you are also aware, H.R. 1 also made considerable cuts to the Supplemental Nutrition Assistance Program, also known as SNAP, leaving many of our most vulnerable community members with less access to essential needs of both health care and food. Medicaid covers more than a third of Michigan births and is the largest payer of behavioral health care and long-term services and supports for seniors and people with disabilities. SNAP is vital for families in rural and urban communities alike. The program supports children, older adults, disabled people, and millions of Americans who work jobs that just don't pay enough to cover basic needs. It's also one of our most effective tools in improving health outcomes and reining in healthcare spending, which is why it's so closely tied to the conversation around healthcare and Medicaid. As H.R. 1 is fully implemented over the next few years, the act will create a downward spiral into worse health and deeper poverty. For the about 450,000 Michigan households who are enrolled in both programs, increased hunger will create greater health threats, while access to the care they need is taken away. Facing greater out-of-pocket costs for vital medical care, families will have to cut spending on other survival needs like food. Though these cuts came from the federal level, you have the ability to help preserve these vital supports for Kent County residents and beyond. As a county, we have a responsibility to take action for our local economy, our community, and our neighbors. We thank you for your work and urge you to consider your over 115,000 constituents who undoubtedly feel the effects of cuts to Medicaid. You have the power to affect change at the local level by adopting the recommendations proposed here today, including adopting access to health insurance as a legislative priority, and helping to lower enrollment barriers by strengthening support for organizations that already assist with Medicaid applications. Medicaid and SNAP are vital to the health and future of Kent County. We urge you to seize this opportunity and take action to protect and support these lifelines for your constituents. Thank you.
Thank you. Is there anyone else?
Chair, just a note for the record that with Commissioner LeGrand's presence, you now have a quorum.
Great, thank you. I appreciate that.
Hello, my name is Hannah White. I've worked at St. Mary's for 12 years, first as a nurse aide and then as a nurse. I've taken care of a wide variety of people from all different walks of life. What haunts me is not how I cared for them, but what environments many return to. Mel Trotters has been filled to capacity during many of the past winters. Upwards of 100 men were turned away into single-digit temperatures because the shelter had no room in the inn. You may recall from 2018 to 2023, the rate of those experiencing homelessness increased 70%, and Black men were 8 times more likely to feel this effect than their peers. No one would choose to live this way. An increase in unhoused individuals takes a toll on the individual, but also on our wider society. Healthcare and education are the 2 biggest sectors in Kent County, and both are tied to the health of those that they serve. Hospitals do not make money on chronic conditions and frequent flyers. The fact that Medicaid is taken away does not mean that we save money. It means that those costs are distributed elsewhere and increased because the efficiency is lost. Meanwhile, schools lose test scores and attrition rates as poverty increases and parents and guardians become overwhelmed. These are only a few of the tangible effects that these cuts are going to have on our society. Luckily, the question is not what are we going to do about it, because our team of health professionals has been meeting for months to put together an action plan of how we can address the HR 1 cuts. While other cities scrambled to catch up, Kent County could emerge as a bulwark to protect its residents. Honestly, what is needed most of all is advocacy, teamwork, and creativity. First, we need to advocate that MDHHS supports the local offices here so that they can help catch up with all the new requirements that are going to roll out. Second, we need assistance in reaching out to our community, especially those who will be impacted. And third, and possibly most importantly, we need your assistance in advocating for a stronger and more recession-proof ways to face, stronger ways to prepare. This is likely not the last time that cuts are going to roll out. Instead, we really need to figure out how to band together with other counties, with local organizations already doing the work to figure out what we can do to protect our residents. Thank you for your time.
Great. Thank you so much. I appreciate that. Is there anyone else that would like to address the committee? All right, seeing no one, we will close that portion of our meeting. Our next item on our agenda is a special order of business. We have the AYA Youth Collective Annual Report. Lauren Van Kellen, Chief Executive Officer. What's that? Oh, yes.
Close enough.
All right. Kulin?
Yeah, you got Lauren Gableman being Kulin. You
Van
got it.
Kulin. I was thinking Kellen, Kulin.
I know.
close.
I'm married into the Dutch.
Yeah, I was just
but-
thinking, his Hollander would be able to come up with something like that. so.
Yeah, exactly.
Thank you, Lauren. I really appreciate that. And,
Yeah.
we usually try to stick around 10 minutes if you can, so we do have a little timer that can at least help you go along. And again, you usually give a little grace here or there too. So if you're going a little longer, don't fret. Don't
Thank
hustle-
you.
hustle too much at the end.
Thank you. And Commissioner Burrell, you're my personal commissioner. I live in Wyoming, so appreciate you. And hi, everybody. Many of you whom I know and have had the honor of working with or have toured AYA have been big supporters of the work. So really appreciate you all taking some time to hear from us today. I just echo all of the public comment. These cuts to Medicaid and SNAP are going to have huge impacts on the young people that we serve. And so whatever advocacy effort that you all can do as part of the commission would be hugely helpful for the young people that we serve as well. But what I'm here to share is just a little bit about what our ARPA funding has done and more about kind of where we're going and the young people that we've had the privilege of serving. So, just a little overview for you. Each year, more than 4.2 million youth in the U.S. experience homelessness. When I talk about youth, I use the federal definition of youth, which is 14 to 24-year-olds. So it's youth and young adults. We know, according to Housing Kent, that there are 36,000 units of housing needed to meet the housing demand in Kent County. I know that the commission has been highly focused on meeting the demands of housing in this county, and we are grateful for that. We right now have found that 430 youth-specific units are required to meet the youth-specific needs. That's in working with our Kent County Coalition to End Homelessness, our COC, through HUD. And annually, over 500 youth enter Category 1 homelessness due to a lack of resources. Category 1 homelessness means that they're sleeping outside or in a place not meant for human habitation or in shelter. At AYA, we are focused, zeroed in on serving this population. We believe that by serving young people, we are actively preventing chronic homelessness. When 40 to 60%, depending on the statistic that you read, of adults first experienced homelessness as a young person. And so we believe that if we can interrupt the cycle of homelessness at age 18, 19, and 20, we start to see a reduction in chronic homelessness over the course of a life. And we're then having individuals who are contributing to our society in really powerful ways. We've seen this firsthand. We have youth that have gone on from living in our houses to purchase their own homes. We have youth who are now bankers and in the construction industry and really, really investing in Kent County in ways that we all then tangibly benefit from. And so by investing in young people, we are preventing long-term homelessness and increasing outcomes for our community. Okay, I have a video, because who doesn't like videos? I think last time I was here, the Conservation District played one. Oh, goodness gracious. But I knew this might be a problem. Eric? What do you think? Should I skip it? I don't want to take all the time. All right. Click it forward. Let's see. No. Well, maybe I'll send it out to you after, and if you would like to watch it, you can.
Again, take your time. I won't count this against you.
It's a good video, I promise.
Yeah,
It's an
no, it's fine.
overview
It'll take a
of
couple
some
minutes.
of what, I can try to log in, let's see.
And I believe this is one of the groups with our new format that we haven't heard in, maybe since ARPA.
Yeah, we
So-
have, yeah.
So this is allowing us to hear different groups, which I think is greatly beneficial.
Well, thank you. I think I gotta log in. Let's see if we can make this happen. Give me 1 second.
Oh, you're good.
Okay. Of course, with two-factor authentication and hacking, my password is not an easy thing to remember these days.
And your dog's name is what?
Right, exactly. Unfortunately, that doesn't work anymore. My child's name? All right, I'll try one more time. And if I can't get it, we'll just keep going.
Now, again, we more than willing to give you a few minutes. I think these are important presentations with groups we have not heard from in a while or ever. We can all give Commissioner Faber our coffee cups.
That's all right. Get your refills if you need them. Here we go. We're making progress, friends. Now I just have to approve it. It worked, but now how do we
Ta-da.
get it on the screen? That's why you're here. Perfect. Yay! All right, well, hopefully it's not too anticlimactic now. And it's muted, hold on.
We can even wait a couple minutes if we want.
There we go. So these are a lot of our team members talking to you all about what we've been up to this year.
So much has happened at AYA this year.
This was a wild year.
Incredible year.
Best year yet, maybe.
2025 was a big year.
We saw 1,037 unique youth this year at Drop-In.
That's so many.
That's a lot of young people.
Of those youth, 637 came to AYA for the first time.
Youth took 1,600 action steps towards stability this year. We supported 227 pregnant and parenting youth in 2025.
Woohoo!
There are so many cute babies here on Wednesdays.
This year, we housed 42 youth in AYA housing.
We had 458 volunteers this year.
We love you, volunteers.
Thank you, volunteers. You are the best.
We distributed 1,550 bus passes and ride shares.
We provided 43 young people with direct cash transfers. Overall, this prevented 128 individuals from entering into homelessness.
We had 10 fantastic interns in 2025.
We have 47 community partners, 14 of which are new.
We added 8 new staff members to the team.
I was one of them.
I was one of them too.
And me.
I was too.
I was one of them as well.
We had 149 meals donated from local restaurants and community members to feed over 90 youth every single day.
In partnership with Upcycle Bikes, we handed out 68 bikes.
In January, we had our annual audit and we had 0 findings.
0 findings equals good.
Look us up on GuideStar if you want to learn more.
2 youth in AYA housing were able to get their Youth Build certifications.
We had our 10-year drop-in celebration.
It was so much fun.
Happy birthday, AYA!
As many of you may recall, in February of 2025, federal funding was a big question mark for a lot of nonprofits. We spent a lot of time going through budgets, going through our programs, looking at all of our funding sources to make sure that we could continue to sustain the support and the services to our youth.
In March last year, we had 600 community members at our Coming Home event.
With the help of community partnerships, we were able to host our first ever baby shower for AYA youth.
In April, AYA broke ground on their first ever new home build, the Jefferson House.
This will be AYA's 13th home, which will add 4 more units for young people.
In May, 59 youth attended our second annual AYA Youth Gala.
It was a night of fancy outfits, celebration, and good food.
It's one of the highlights of my year.
In June, we saw our biggest number of new youth. 80 new youth came to us.
80 is so many.
AYA attended Rock the Block and Pride.
Do you remember when it was warm?
In July, we had our 5th annual golf outing, which is the best golf outing in the entire world.
Thanks to Broadway Grand Rapids, AYA was able to take tons of young people to see Hamilton.
In August, we had 51 youth attend our health fair.
Who doesn't love a good health fair?
A youth in our housing moved into Grand Valley State University and started classes. In September, we supported a youth to purchase a car.
Did you hear that? They purchased a car.
One of our youth enrolled at GRCC.
We were awarded a grant from the federal government.
Getting funding from this administration was surprising.
In October, our housing program had a pumpkin carving competition.
We hosted a job fair with local employers at our drop-in center.
Our Youth Supporting Youth campaign kicked off with a pop-up bike repair shop at a local high school.
In November, we had our first ever used clothing drive and had the help of over 20 volunteers.
There were clothes everywhere.
87 youth attended our Thanksgiving party.
And there were 18 pies. We ate them all. This year, we held our first ever We Exist event. This event brought together community leaders, community partners, and youth to talk about youth homelessness and how we can make solutions happen in the community.
65 youth attended our holiday party.
3 youth moved out of AYA housing into their own apartments.
Woohoo! 3 youth in AYA housing saved over $2,000 each.
That is a huge accomplishment.
At the end of this year, we bought this building. It is so exciting. It triples our square footage. It's gonna allow us to serve so many more young people. We're gonna have an adolescent health center and a commercial kitchen and spaces where youth can meet with a therapist one-on-one, individually, without 10 of their friends standing around them. We cannot wait to see what this building does for AYA and for the young people we serve and how it opens up even more housing opportunities across our community.
Thanks to you, we're making a difference.
Thanks for your support.
Thank you so much for supporting this work.
Thank you for how you've all shown up this year.
You are the best.
2025 proved really difficult, but we accomplished a lot. We expect the same for 2026, but we're ready.
I think everybody else has a lot to live up to. That might be one of my favorites I've ever seen, so you might be the new bar.
Well, we have an incredible advancement team, I have to say, who, if you want a really fun event to go to next year, to break up adult prom season, which usually happens in both the spring and the fall, we have a good one as well. It's a good time. Okay, am I here the right way? All right. Let's see. Oh, goodness gracious. Thank you. Yeah, just that easy. Okay. As you can see, AYA did a lot this year, and that's in large part to the support of our county, our city, our federal government, our state government, and many, many, many individuals in this community. One of the things we've really been working on is understanding what is the demand going to be over the next 10 years as we continue to see growth in this population. So we know that Kent County is amazing and is growing, which is unlike most of the counties in our state, right? And a lot of that growth has been driven by the opportunity population, the young people, 20 to 30-year-olds that are going to school here and staying here. And so AYA serves some of the most vulnerable of that opportunity population. Yeah, as I mentioned before, a lot of those young people all of our young people have so much potential to offer to this county. And so by continuing to invest in them, we are able to see those results as a community. So what we're trying to do is forecast, okay, based on the growth at the county, based on the growth that we've seen in homelessness through the Kent ISD data and local COC data, where do we think we'll be over the next 10 years if we really want to solve this? Our big, hairy, audacious goal is every youth in Kent County has the relationships, resources, and housing needed to resolve their instability. So we had to figure out first how many that is. We projected that out, like I said, with a bunch of different data sources. We're thinking that it'll be about 3,200 in 2035. We're also projecting out that are gonna need our services. Let me clarify that. We're also working on projecting out at how many units and what type of units do we need in our county to serve every single young person. And then finally, we're looking at what point, if we start preventing youth homelessness, at what point could we stop building? And so at what point could we actually build to meet the need, to solve the problem, and then we no longer need to build anymore? And instead, we've kind of reached a homeostasis in terms of solving youth homelessness is kind of hard to say. Youth will always experience homelessness because there's a lot of reasons for it, but that any young person who's experiences homelessness gets matched with the resource right away and then is on the track to stability. And so I don't have those numbers for you today, but hopefully I will soon. And really it's getting to the question of how do we solve the problem of youth homelessness in our community? And I believe we can. We have the will, we have the people, and we have the growth to show. So part of that you saw me mention on our video is that we've purchased 241 State Street. For those of you who know, we're right in Commissioner LeGrand's district. And our current drop-in center is about kitty corner to this building. And so we purchased this building to expand our drop-in center. We're hoping to pilot a type of transitional housing that we went and toured in Denver at our current building. And this new building will be expanded to our goal is that this building will be able to accommodate those 3,200 youth. So this building will be available for the long term. And then we hope that we can leverage tax credit financing, federal home loan bank financing, other public funds to then build housing on one of those parking lots. So we're really excited. We're partnering with Catherine's Health, who you heard from today, for adolescent health care. And yeah, we're just thrilled to look at what this expansion means for young people in our community. And because of this, we're laying the foundation to be able to support every single young person in our county.
With the mention to Catherine's Health, with ARPA dollars, there's a $2 million, I think, with cooperation through Catherine's Health.
Yeah.
Do you have any, you might be going there, I'm just maybe jumping the gun a little bit.
No,
but
you're good. It was on the last slide and I skipped it because I had my notes here. So we were the recipient of ARPA dollars, $2 million. It was to grow our comprehensive health initiative. One of the things we wanted to produce was a white paper. So we're in the final stages of validating that white paper to showcase the importance of comprehensive health care on site for young people who are our most vulnerable. So we'll be able to send that out as soon as that's finalized. Catherine's Health has been our main partner in that work, and we are getting to the place where we're on track to see enough young people where it will be a self-sustaining partnership, where Catherine's will be able to, now, pending all the Medicaid changes, let me add that caveat, because that's something we didn't anticipate when we got ARPA dollars, but pending all the Medicaid changes where we'll be able to, we won't have to fundraise much for those services because Catherine's, being a federally qualified health center, is able to bill at 3 times the Medicaid rate. And then our youth are able to receive services. And through ARPA, we've been able to establish a partnership with the Department of Health and Human Services. DHS has a worker on site. Prior to having that worker on site, we had a less than 3% enrollment in Medicaid and food assistance from our young people, although probably 96% qualify. Now that DHS is on site and has been on site for almost 2 years now, we have a 96% enrollment rate of youth actually receiving Medicaid food assistance, child care assistance, those kinds of things. So we really are able to leverage that public-private partnership and those public dollars to then help support young people in getting access to everything that they need. And then we've also been able to bring behavioral health on site, even through Catherine's psychiatric care. They have a psychiatric nurse practitioner, so a lot of our young people do, especially our most vulnerable young people, have really complex needs. And to reduce the pipeline into chronic homelessness, we really have to serve and support young people with really complex needs. And that generally means that there needs to be some kind of psychiatric care and intervention as well. So let me see if I missed anything. So we've learned that youth outcomes improve when systems are connected rather than fragmented. And that's been a really big learning. And that's a lot of what the white paper will share, is that we have data to prove that by connecting systems, you see huge growth in young people. And we're able, eventually, I'd like our data to get us to a point where we can say that by intervening in this way with wraparound resources, we're saving X dollars of public dollars, whether that's from emergency room visits, whether that's from ambulance calls, jail and prison time, things like that. And so we're getting there. I don't have those numbers for you today, but I will have those. Anything else about ARPA?
Commissioners. Commissioner DeBoer.
Thank you, Chair. So I'm not very familiar with your organization. Can you break me down just some of your financial, great work, by the way, I don't want to not say that, but your revenue sources and your expenses, kind of break down some of your financial statements for me?
Yeah, sure. So this year, we have a 6.2 annual budget, million annual budget. When I started the housing program, we had an $11,000 annual budget. So we have grown significantly. It's been a joy to be a part of. Of that, we have a capital project that we're working on that's looped into that. So if you pull that out, our operations are more like $5.5 million. Of that, about 50% is funded by foundations. Of that 50%, 45% is public funding. And so that comes from state, county, city, and the federal government. We have 2 large federal grants. So a lot of what's happening with HUD right now and this next NOFO that's going to be released will dictate about $1 million in resources that then we partner with other agencies and we support 50 young people in housing. We house 50 young people with those dollars. Losing those dollars would be a big deal. The remainder of our funding then the other half of that is local philanthropy. And then the remainder of our funding is made up by a little bit of program service revenue from rent that's paid for youth in our housing, and then individuals and corporate sponsors. I think we have 400 recurring donors, which is it's a lot for a nonprofit. And we had over 950 community members attend our event this year. So we've just seen a lot of community support, which has been really encouraging. Yeah. Thank you. Thank you. So we're grateful that we have diverse funding streams in case we lose one, then we're able to hopefully modify or pull over here. But losing that HUD funding and losing our TLP funding, which is our transitional living program funding, would result in almost 100 young people not having housing. So it's pretty significant. And there needs to be, we're continuing to advocate for, in touch with Skolton's office about the NOFO for HUD and what they're gonna do, but that's tricky.
Thank you, Chair Burrow. So good morning. There's so much here. I think we need another hour. First of all, acknowledge the organization and the work that you guys do. It's incredible. I love the fact that this sort of percolated up from the community as they saw the need and they started working on it. And it is, for those of us that have worked in nonprofit worlds, for you to be where you are now after 10, maybe 15
Yeah.
years is pretty incredible.
Yeah.
So kudos to you and everybody that's working. I've done some work in the chronic homelessness situation, but the environment, the circumstances, the dynamics are totally different, I think, than it is for you in dealing with youth homelessness. What is, I don't know how many questions you're going to let me get away with, but what are the circumstances, the principal drivers for youth homelessness? In adults, I mean, we look at substance, we look at behavioral health issues, obviously economic issues. What are the principal drivers for youth?
Yeah, good question. About 30 to 40% of our youth identify as LGBTQ. That doesn't mean that they were all kicked out of their homes because of their identification, but they're definitely, that does happen. Many of our young people, about 30%, have aged out of foster care. And so we're working with the Grand Rapids Housing Commission. We have access to FYI vouchers, foster youth to independence vouchers, getting youth supports and connections to apartments through that program. We know that about 10% of the youth we see have really severe and complex mental health needs. And so that's where I was kind of mentioning that psychiatric care. We're actually piloting the house in the video that we were just building that is almost completed, is going to be for our most complex young people. And in our housing program, we have unpaid house mentors that live for free. And this one, we're having a full-time paid 24/7 support to try to see if we can support those really complex young people. Some are fleeing abuse and neglect in the home, and we're working on family reunification or figuring out, sometimes it's safe to return, sometimes it's not. The family is experiencing homelessness, and they're saying, hey, you're 18, you just gotta figure this out. Like, I have 4 other kids I gotta provide for. And then the last percentage, I'd say, are teenagers and young adults that are just struggling. And maybe their parents are like, we don't know what to, they might have loving parents at home, and the parents are just like, we don't know what to do. You gotta leave, you're not safe at home. And then we're working those situations, that's when we really focus on reunification, rather than adding units. You know, if we can figure out how to kind of broker some of that, and they already have family support.
So it strikes me that the principal dynamic is transition. You are looking to work with individuals that are transitioning from an unacceptable environment to a more long-term acceptable environment, and housing is a critical part of that.
Yeah, and let's see, I'm trying to think of the number off the top of my head. I think over 350 of our young people were sleeping outside or in emergency shelter last year. That is the population that then will enter into chronic homelessness. And so their barriers end up being on the front end similar to those that are chronic, and you will see them outside when you walk around. And so we're also part of the Downtown Pathways Project at the city level to figure out how we're supporting those young people, because the longer that a youth spends outside on the streets, the more likely they are to end up as a chronic adult.
Yeah, and I guess that's what I'm learning, is that the recipe for us dealing with the chronic homelessness, the adult chronic homelessness, is not necessarily the recipe that you deal with.
Correct.
And same thing with behavioral health.
Yep.
As Commissioner LeGrand knows, we're working on getting that adolescent crisis stabilization system going. It's hard, it's difficult, but that would in part help you deal with that. But the point is that adolescents are a totally different process than dealing with adults. And so I assume that a lot of the existing systems for adult homelessness don't fit well for what you do.
Absolutely. If you're 18, or if you think about you or your child, maybe, that's 18, And
There's no 18-year-olds.
there's no
here.
18-year-olds. Think about when you were 18. The vulnerability of having to go and sleep in a congregate shelter with a 60-year-old man is really scary. And we've had young people that have experienced victimization, mostly on the streets, not always at the shelters, but by those same individuals. Due to those individuals experiencing lots of trauma and lots of mental health concerns themselves, but oftentimes young people are like, I don't feel safe, I can't go there. And so we do need a youth-specific solution, which is kind of where AYA really comes in and fills that gap.
So last question, Chair, I promise. What's the greatest need you have now? Is it additional physical housing units? Is it caseworkers? What is the most critical need?
Yeah. We survey our youth every 6 months to ask them what they need. Housing is always number one. When we talk about expansion of housing, we're talking about building more units, yes. That's why a big reason why we purchased our new property. But also navigating with landlords, figuring out landlords who are willing to rent to somebody who doesn't have 3 months rent and a long credit history, those things like, if you're 19, you don't have
Do they
those
rent
things.
under their name or does the AYA sign?
We've done both. We have both options available to them. And so really every young person's different, but it tends to fall into like different categories. So some young people come in and they need prevention dollars. They're on the precipice. They're about 2 weeks out from experiencing homelessness. And we have a program. I'm actually speaking in New York at a national press conference about this program that we have in Kent County. We're one of seven places around the nation that do this. And so some young people need prevention, some young people need an early intervention or a crisis response, similar to the mental health system, right? Some young people need a longer term housing solution. And so those are the numbers that I'm really close to having of these are the types of housing that we need to actually solve the problem.
Great.
Yeah.
We'll keep at it.
Great questions. Thank you.
All right. Commissioner LeGrand.
Thank you, Chair. Thank you for the report. I'm one of those commissioners who was around during the ARPA day, so it is a thrill to see the dollars really flourishing in the community in services like yours. And congratulations on the new building.
Thank
I
you.
walk by the current one every day, and I was delighted to hear that very underused building is now going to really serve such a great purpose. And it seems great that you're so close to GRCC and the library. Has the library been a partner of any sort for you?
Yeah, the library, first, they're just a partner in general in terms of they'll call us if a young person's there. Sometimes they've walked youth down. Sometimes we've had youth go there to help another young person. Our advocates go there on a regular basis just to do outreach to make sure we're connecting with youth that are going through the library. We've had it's been a while, but we've had some larger conversations with the library about ways that we could partner. So yeah, they've been a huge support. I think on the video it said we have over 45 community partners. That's real. Those are MOU'd community partners. Those are partners that are like, that's not just me saying, oh yeah, we partner with Pine Rest or whatever, no, those are people that are in our space either on a weekly, monthly, daily basis supporting young people because we don't want to do it all. Our goal is if someone's willing to work with young people, we're going to partner with them. If we have a gap, right now we have a gap in pregnant and parenting, we're not just adding pregnant and parenting houses. We're going to figure out who's doing the work already and how we can just connect the dots.
Great. And the new housing unit that is going to be for those with,
more complex needs. Yeah,
exactly. Did you say there were 4 units in there? And is that like individual rooms or are they individual apartments or how is that?
Yeah, it's technically a 2-unit property. When we say units, we're talking about bedrooms due to HUD guidelines, so it gets a little wonky, but it's a 2-unit property. The main floor is where the house mentor will live, and then there's 4 SROs, actually. We're one of the first building new single-room occupancy units. And so they'll have like a little kitchenette kind of thing, their own bathroom and a bedroom. And then there's a shared kitchen area as well. So we're excited. We're gonna test it out.
Yeah, I mean, it does seem also to connect with some of the like 100 in 100 work that's been done.
Absolutely.
Where they've realized that supportive housing is really one of the most important things.
Yep.
So good luck with that. It sounds amazing.
Thank you.
And, you know, your growth has been impressive, but it's not just good administration that speaks to the need that we have. So I'm just really glad that you're there to meet that need, and thank you for all the work that you're doing.
Thank you. And I really appreciate, you've been a huge supporter since we were trying to get those ARPA dollars, so thank you.
Commissioner Morris.
Thank you, Chair. Just a quick note, thank you very much for the presentation. I'm very much more now, more informed than I was before about this organization. I appreciate your time and energy behind everything that is going on. This was fantastic to dive deep into this, and I appreciate everything you guys are doing. Fantastic job. If there's anything that we can do on an individual level, please don't hesitate to reach out, because this is a fantastic show of what an organization can and should be doing, impacting the lives of young people in our community, and I love it. So great work.
Thank you. I really appreciate that.
Any other commissioners' comments or questions? Again, Lauren, I really appreciate it. I think you have at least one staff member with you here today. All right, and what is your name?
Eric.
Eric, nice to meet you. Just the enthusiasm, you know, you're both smiling when you're talking about this, and it's because you obviously love your work. So it's kind of made my day, just kind of seeing Eric, you responding out there too, smiling, Lauren, you as well. And uh-oh.
Oh, you're really kind.
I love it. I love it. Your employee review is at 4 today? Is that what you were saying earlier?
Exceptional.
But again, if your leadership and what you're teaching and leading by example in that video, everybody seemed to be really authentic. And again, that was one of the best presentations that I've seen on a video. So
thank you.
Again, great work. I agree, Commissioner Morris, on just learning more about what we do here in our community and our support that we give our nonprofits, and it's really amazing, and you do great work. So again, we really appreciate your time here today.
Thank you so much. I really, all of you, and for your support over the years and your continued support. If my information's up there, our Vice President of Advancement. If any of you ever want to tour, if you haven't been, it's a pretty cool place to see. So love to show you our new building and what we're going to do as well. So reach out.
Great, thank you so much.
Thank
Appreciate
you.
it.
Thanks again for having me.
All right, you bet. All right, our next item on our agenda is the Kent Conservation District Annual Report. Jerry Miller, Board Director Chair, and Aaron Sloan Turner, our District Manager. I had to keep on reading there for a second. I was like,
Good morning, Commissioners, and thank you for providing Kent Conservation District an opportunity to do our annual update. As you indicated, I'm Jerry Miller. I'm the Board Chair and Director for the district, one of the 5 board members, and I'll introduce those in just a few minutes. But first, I want to thank, the Commissioners for your ongoing support, funding support for the district. It has been very important for us to continue to have an operation that we can serve your constituents across Kent County. So thank you very much. With me today, I have Aaron Sloan Turner, our District Manager, and Ryan Willimski, who will be sharing some comments about his work with the district and with constituents here in Kent County and some of the partnerships we have with other units of government here in Kent County. Just as a quick review, conservation districts across the nation came out of the Dust Bowl. Here in Michigan, Public Act 239 in 1937 provided local entities, local units of government to establish districts. The first district was established in 1946. Kent had 2 districts initially, and they were established in 1950, Northwest and Northeast, and they came together as a single unit in 1950. We are governed by a we are governed by a 5-member elected board, locally elected. We serve 4-year terms. I wanted to add also, in addition to the initial Public Law 451, 1994, provided the specific responsibilities for the district directors. And in your packet, in the green packet you have, on the left side is a listing of those responsibilities to include addressing soil erosion, to include addressing appropriate land uses, and also addressing surface and groundwater non-point source pollution. So that is that is our function. Those are our responsibilities for our board directors. The directors shown here on the left, obviously I'm on the left. James DeYoung, farm consultant, is next to me. Next to James is Carly Kochi. She's a farmer and she raises beef. And next to her is McKenna Rivers. McKenna is an attorney. And next to McKenna is Colin Crumbach. He was on our board for 4 years. He stepped down and we appointed him as associate director. He doesn't have to be elected, we can appoint. And then on the far right is Jacob Nordis. He's a new elected board director. So those are our board directors. We have one other associate director, Kali Rash. Kaylee is also on your Kent County Farmland Preservation Board. She represents conservation interests, so she reports to us about the ongoing of the Farmland Preservation Board. Our staff over on the right, and we have a few others, but obviously Aaron there in the front on the right side, and Ryan standing behind her, and you'll hear from him shortly. So with that, I'm going to introduce Ryan, and he's going to share with you some of the work that the invasive control team is doing. And Ryan, you're up.
Yeah, thanks so much, Jerry. Good morning, commissioners. This is my first time speaking at one of these meetings, so I'm honored that you invited me here. I'm going to share about the program that I manage. So I have been with the district for 5 years, and I've seen incredible growth of our invasive species and habitat restoration program. We're essentially, we are working to protect the natural assets of Kent County from invasive species and ecological degradation. So if you're not already familiar, invasive species are plants, animals, fungus that are not native and whose introduction causes harm to Michigan's economy, environment, or human health. So there's a difference between non-native plants and then invasive plants that are of much higher concern to the state. Another way to think of invasive plants are as biological pollutants that impact the natural heritage of Michigan, our human health and safety, and our local economy by outcompeting crops. When managing invasive species, we really rely on early detection and rapid response. The earlier we can get in and detect a watch list invasive plant, the lower control costs are and resources needed to allocate to manage that problem. The longer that plant is able to get established in an area and spread over a larger geographic area, the higher those control costs are. So public awareness typically begins unfortunately at that median point of the plant existing for a while and people noticing it in so many places like their backyard, say, and realizing, maybe this is an issue that we should address. So we have 3 strike teams that cover our 7-county West Michigan Cooperative Invasive Species Management Area. We have 1 team in Kent, 1 in Ottawa, and 1 in Muskegon, and we cover our own service area. So the Kent Strike Team service area is Kent and Montcalm County. Recently, we have also added the east half of Newaygo as well, split by M37. So we respond to requests from landowners, both public and private. We work with park managers, including county parks, township parks, city parks, and public works employees to educate them on the importance of managing these natural areas and sharing best practices. In 2025, our small team of 5 team members was able to restore 800 acres throughout our service area. A large portion of this was public land, parks, preserves, easements, and DNR game areas. Over 400 acres were restored for private landowners throughout the county and Montcalm County. And we've also covered 70 acres of right-of-way and gravel pit treatments as well. Through our program, we have a no-cost site consultation that's funded through a grant, and in 2025, we offered 83 no-cost site consultations to residents of the county. So I just want to highlight a couple of our partnerships. We treat 97 right-of-way sites throughout Kent County through contract with the Road Commission. We survey all gravel pits for watch list invasive plants that the state of Michigan DNR really want to know about, and so we can manage them as early as possible, going back to early detection. And we also provide annual training to the mowing crew of the Road Commission to be able to identify the most noxious invasive plants and to be able to report those to our team so we can manage those. And I actually have that training I'm leading tomorrow morning with them. So really happy to grow that partnership over the years. Another great partnership of ours is with the Kent County Parks. Last year, we treated 117 acres throughout county park land in coordination with their own in-house restoration team. Many of these parks are right along the Grand River, and that is also where the invasive bittersweet vine is most prevalent. So there's an image of that to the top right. Maybe you've seen it around the county. It is really quite prevalent in this county specifically, and is quite an issue. So we are partnering and kind of holding that as our highest priority because there's a lot of invasive plants out there, but this one is especially dangerous to our ecosystems and even our economy because they can, within a short number of years, strangle trees and kill them. So it's the only invasive plant that we have that's prevalent in Kent County that's destroying our forests and our riparian forests mostly, and which we depend on to retain floodwaters, filter our rainwater, and provide great wildlife habitat. And talking about wildlife habitat, we also partner with the Michigan DNR. Over the past 5 years, I've had the privilege of leading 2 wildlife habitat improvement projects. These are grant-funded initiatives where in total we've restored 300 acres of public land through survey, and we have been managing these areas for the past 5 years. And our DNR partner has been very explicit in saying that this work would not be happening if it wasn't for us acting as a local partner, since they have such a large region to manage. And finally, something that I feel the most fulfillment in is connecting with landowners throughout the county and providing that education piece of how we can spread these best management practices, and really working with the landowners throughout a series of years to see real improvement on the property as well. So we assist over 300 landowners per year, offering grant-funded initiatives when possible and available. And I also will provide this information at no cost over email and phone. We identify plants through pictures all the time, and we're happy to do so. And then I just wanted to leave off, this was a project we recently took on back in March with Commissioner Bujak. He invited us over to his Thornapple Riverfront home, which had a tangle of invasive bittersweet vine right along that stream bank. So we went in, me and one other crew member, we cut and treated it to make sure it doesn't come back because cutting alone is not sufficient. And then Mr. Bujak, he was kind enough to offer his riding lawnmower so he could remove that biomass. And yes, it was a very big job, and yes, it looks a heck of a lot better, as you can see from the before and after. So yeah, excited to see that restoration project unfold too. That's all I have to share with you today.
Wonderful. I appreciate that. Commissioners, any comments or questions? Commissioner LeGrand.
Thank you, Chair. I saw a lot of red spots on the invasive species in Grand Rapids. Does that mean I can call you when I find Japanese knotweed in my front yard, which I do every year?
Absolutely. Yeah, when I
I
started.
can handle it so far, but.
Picture can be
Yeah.
Yeah, I'll be on next year.
When I started back in 2021, that was the primary focus of our work. We had state grants that funded that. Those grants have kind of changed in what they do fund now, but we still treat as part of our for-hire program, our not-for-profit.
I understand some people can't get house insurance if they have Japanese knotweed, at least in some areas, maybe not in Michigan yet, but if you have it, because it's just so damaging.
Yeah.
It's crazy. Well, you didn't talk about the tree and plant sale, which I love, and I want to speak for how amazingly resilient these plants are, because I discovered one this spring that I never planted, and it was exposed all winter in this little thin plastic pot, and it was still alive, so I planted it in the spring. So after this winter, that was very impressive, and it is really, they have beautiful plants and so much information on how to plant them and help the pollinators and everything. So that's a really great service that you guys do. Love the plant and tree sale. Thank you.
Thank you.
Commissioner Morris.
Thank you, Chair. Thank you for the presentation. I love listening to this. It's something that if you don't know much about, you learn so much in this field, the science field, I guess, of the invasive. And we work hard up in our neck of the woods to try to alleviate some of that invasive along the Nash Creek banks with a retired teacher, and we've worked with her quite extensively on working through some of that, because we were a volunteer club that was cutting back, and we weren't doing the, she calls it daubing, but like we weren't doing that part of it, and she educated us that we were actually helping it grow more ferociously because we weren't going through the proper procedure of making sure it, stays back. So I just give you guys kudos for helping out the county. And if there's anything in Northwest County, I noticed on the Kent Strike Team service area, there isn't a lot in Northwest Kent County. And maybe that's a little bit of, I don't want to say fear, but the idea of if somebody's doing something, or the idea of you having to come in and tell us, oh, all this has to go, or something that cost, or just the idea of somebody's coming onto my property to tell me what to do with it. If there's any way we can help communicate or, with some of that, I'm happy to help with that, because I just noticed there was a lot of, not a lot of red dots there, but I can't imagine there's not a lot of invasive species there.
Yes, absolutely. No, that's a great point. So yeah, we are a request-based service. We have very little funding to go out and survey and find the problem areas. So we really do rely on community partners to help, keep that communication fluent. And yeah, like you said, just because there's a gap doesn't mean they're not there.
Yeah.
So there's definitely an opportunity there. And something that I've been very pleased to see over my 5 years here is every year we are covering a larger geographic area. So I think this is another great opportunity.
If I can help, please let me know.
Absolutely.
Thank you.
Commissioner Steck.
Thank you, Chair Burrow. Good morning, and thank you for your work. Did you also mow Commissioner Bujak's lawn?
He was trying to tip us to do that, but we can't accept tips, so. Yeah.
Okay. That was not my question, that was a comment. So, do you also address invasive animal species, insect species? You didn't talk about that a lot here, but if so, what are the key, most challenging animal invasive species we deal with here? And I assume from my hosta's perspective, it's not deer, but.
Yeah, that's a great question. I guess you said insects, so I'd like to start there.
Sure.
Within our West Michigan SSMA, we don't have it. Last year, that would have been true. We have one occurrence of hemlock woolly adelgid. Technically, it's not in Kent County, but it is in Amman Park, which is a City of Grand Rapids park. This is a small insect that has a long proboscis, and it sticks it into the needles of the eastern hemlock trees and sucks the sap out, and is another forest pest that's killing our hemlocks within just a matter of years. It's very prevalent along the Lake Michigan shoreline, unfortunately. And there are preventative herbicide treatments that we've seen to have great success at preventing it. But yeah, we are seeing that start to move inland, towards Kent County.
Is there anything that, like, individual landowners can do? It sounds like that may have to be sprayed to address it.
Yes.
Aerial spraying.
Yes, there is it's a spray operation. Really you're just looking for, it kind of looks like cotton fluff, like from a cotton ball on the underside of the hemlock branches. So that's something to look out for, absolutely. And oak wilt is another one that's really kind of starting to spider out, just its method of spread. It can spread right now. We don't want to be pruning oak trees because it releases a sweet-smelling sap that can attract the nitty-doolid beetle from a mile away. It's really incredible how adapted they are to picking up those odors. And then that's how that fungus gets spread from oak to oak after, whether it's pruning or natural damage in a thunderstorm. That's, also something we're seeing spreading is oak wilt to our red oaks.
And are you guys the ones we should be calling when we see the long proboscis insect or whatever? Or do we call the DNR?
It's great to know. So we do work very closely with the DNR. If you report that to the Conservation District, we will make sure that the right people know about it and it's cataloged and verified in the field.
Okay. And animals? Any animals we should be looking for?
Yeah, right. I know the deer do feel invasive these days.
We have another committee for that, don't we?
Yeah, no, we don't specialize in animals. That would be another, report to the DNR for that.
Okay.
So, yeah.
Thank you.
Thank you.
All right, any other, Commissioner Faber?
Thank you, Chair. Thanks for all your work. I had the opportunity to go to your annual dinner this year, and just really remarkable the reach that you have with a small but mighty staff. So thanks for all your great work. Could you talk a little bit about sort of your interconnection with, say, the Drain Commissioner? That's an area where, we're funding a lot of projects. Sometimes it feels like we're just trying to get water away opposed to maybe doing some of the habitat restoration work, but I know that's happening. And then Commissioner Morris sits on our Agricultural Preservation Board, and I know you probably have a whole nother presentation on all your ag work, but we look to you to really support our farmers in that work, and maybe talk about your integration with our ag preservation, their new strategic plan and where they're headed, and how that's going to hopefully impact your work, or you can help impact that plan.
Yeah. So I think that might be a better question suited for Jerry Miller here. But I will say with the Drain Commission, we have had efforts in the past for projects that we know are gonna introduce disruption to stream banks and riparian areas. We will go through and survey those for aggressive invasive plants where just mowing them down is actually gonna make the problem 10 times worse. And we'll go in and try to manage those proactively.
Thank you, and thanks for being at our annual meeting. We have a couple projects, one in Mill Creek, which comes out of Cranberry Lake on the county line. We've worked with the Drain Commissioner and his staff in terms of stream bank restoration and so forth. And another one, we do not have a funded project right now, but we're working with the Drain Commissioner and his staff in Nash Creek also. So those are two current projects. There are other projects or topics that come up. Generally, on both of those projects, there's a monthly meeting, virtual, and quite often the commissioner or Joel Morgan, his engineer, will sit in on those and provide information and comments and suggestions and so on and so forth on the ongoing work in both of those watersheds. So that was the first question. I'm sorry, the second question.
Yeah, sorry, I commingled there, but agricultural preservation. So I know you're doing a lot of work to support farmers with best practices around really retaining soil. and creating better, healthy soil. But we also have this other work, which is just generally preserving family farms and our ag business and the ag preservation. What's your connection with our ag preservation work?
So we have a associate director, Kylie Rash, who is on a 3-year term with the Kent County Farmland Preservation Board. She represents the conservation seat for that board. So she attends those meetings. She gives us an update, reports back on the ongoing. And also we work very closely with Administrator Vanderberg's staff, Haley Steckman, and we communicate with Haley on a regular basis as well. So we work with USDA. We are co-located with USDA Natural Resources Conservation Service, and they, in their easement, the agriculture easement program in the Farm Bill, they provide funding for farmland preservation. They don't have a lot of funding, but they do provide funding. And I think I just read in the Farm Bill that they are trying to get passed. In fact, it's going to the full House this week in the House of Representatives. They have increased the funding, the cost share from 50% to 65% to get additional funding into farmland preservation. The NRCS, the chief of the NRCS has 5 priorities. Her number 1 priority is farmland preservation. Her comments are that nationally, 5,000 acres a day are converted out of farmland. So she has this as her number 1 priority during this administration. So part of the reason that they're trying to put additional funding into their easement program. And of course, we work with our local NRCS district conservationists.
All right, any other commissioners' comments, questions? All right, seeing no one, we really appreciate you being here again. And again, I think with our new format, this does allow for a little longer time for each individual group to go, for us to learn more, know more. We've got a lot of moving parts here in the county. It's hard to know everything that goes on, and these are presentations that help us gain some knowledge and some insight. So again, appreciate your work.
Great. Thank you very much again for providing us an opportunity. And again, thank you for your ongoing financial support for the district.
Okay, thank you. All right, our next item on our agenda is approval of last meeting's minutes. Do I have a motion and support? Motion by Commissioner DeBoer, supported by Steck, I thought I heard.
Yes.
I thought I heard a sound in a couple different spots.
I support that.
All right. All those in favor of last meeting's minutes, please say yes. Yes. All those opposed, last meeting minutes have been approved. We have 2 action items on our agenda here. This first one is brought to us by the board office, 2026 federal and state legislative priorities. Can I have a motion and support, please? Motion by Minority Vice Chair Faber, supported by Steck. Commissioners, comments, questions, or concerns? Commissioner LeGrand.
Yes, thank you, Chair. I am curious about the, on the page of federal priorities, which I had up and then lost it. On the second page there, we talk about mitigating the impact of federal policy and appropriations on local services, and very glad to have heard community members speaking to us about Medicaid. And I'm just wondering if theoretically that is in there, if we should be putting the language in actually, because definitely keeping track of those Medicaid cuts is, I mean, that having huge impacts in our community. Network 180, for example, our funding is from the state is based on a Medicaid enrollment, which is becoming much more difficult. It is it will specifically affect Kent County. So I don't know if that is already.
We consider that to be already there. The problem is there's such a wide range of spending that benefits and could impact the county in a negative way that if we couldn't identify all of it sometimes until it happens. And then, so we thought it would be better just to kind of have a catch-all for that.
Okay, thank you.
All right, Commissioner Steck. It's the, it's,
It's the ayes, I get it. All right, thank you, Chair. So, I've worked for a lot of years with these legislative priorities, back when I chaired this committee or its predecessor and in subsequent years, and have come to really appreciate that these in some way are the tip of the iceberg, and the actual focus and energy and activities that we undertake over the course of the year are substantially broader, deeper, and more involved than what these might suggest. So I continue to accept them as sort of summary statements, and perhaps those that are priorities that have survived the test of time and go on and on and on and have a lot of applications. So I think certainly for the public to understand what these are and what they are not restrictions and limitations on our engagement and other activities, because there are a lot of things that are very important to us and to our constituents over the course of the year that we do take on and we do raise, and whether we do it through the administrator's office or through some of our committees or authorities, Network 180 being one of them that has unique kinds of interests. So I think these are fair statements of what are prevailing priorities, both at the state and the federal level, but again, underscore that they are not the only things we're interested in.
How about MVC favor? That might be easier for me, yeah. There we go, it's close.
So I was going to share a similar comment to Commissioner LeGrand. I think the second bullet under mitigating the impact of federal policies and appropriations on local service. We're preventing the unintended financial strain on local governments, but it's really on people. It's the people that we serve that are getting, yes, it's a strain on us, but I would just encourage maybe before this goes that we tune that a little bit more to talk about the impact that some of these cuts and new sort of restrictions are going to have on people. So just a suggestion. And then the one other one that I chimed in on in the draft, the fourth bullet under securing long-term fiscal stability for local governments, the state legislative priorities, opposing property tax exemptions that do not make the county whole. I don't know that I can agree with that statement. I know there's been a lot of talk about maybe doing something with the pop-up tax for seniors specifically, and to me that would be something that would fit underneath that bullet, where maybe we are allowing seniors that relocate within an existing community to avoid that pop-up. And I wouldn't expect that the county would be made whole if somebody got that exemption. And I think I've heard pretty universally from my fellow commissioners that that would be something folks would be open to if that came forward. So it felt like an overly broad statement that I don't know that we can, I don't know that there's support to fully back, but maybe I'm misinterpreting the statement, which is possible. But if I am, then I would suggest that we need more clarifying language.
I would say that that statement doesn't include more recent attempts or stated attempts to reform the Michigan property tax code. But it seems like on an annual basis, there's a range of proposed exemptions. For example, whether it be veterans, whether it be, and that might be great, but the state is making a decision in that case to reduce local property tax revenue. And so over time, I think that has been an attempt to say, the state's the state can do whatever they want, but do it in a way that keeps local governments whole, especially when the state is mandating services that in a 2006 study showed that they were behind $2.2 billion in funding county mandated services. So the idea is the state needs to live up to the law regarding them paying what they need to pay for local mandates. And the further they do exemptions without making us whole, the further they prevent us from meeting the mandates that they give us that could be argued are unfunded mandates and not legal. So that's really more the background of it. Whatever tax reform, I was actually around when then Senate Majority Leader Engler first proposed property tax reform, which resulted in the tax freeze of 1993 and Proposal A of 1994. And the pop-up is literally what keeps places like Kent County flourishing. And again, the pop-up doesn't affect the people who already own the home, because they have the homeland tax exemption that they can apply for. And so it impacts people who are buying new homes, because that's when it becomes uncapped. I'm not trying to minimize the problem. I'm not trying to say it isn't something that shouldn't be addressed, but Proposal A had to be voted on by the people as a constitutional amendment. And so obviously that would be a much bigger deal than kind of the annual mini battles that we fight over exemptions that different legislatures like to propose.
Yeah, I appreciate the clarity. I still think it's such an overly broad statement, and it wasn't I just don't know that it's really that helpful, because it's all about the nuance. And then I would just say that one of the number one issues I hear in my district is seniors that are currently feeling really stuck in their home, because if they try and move to a different place, they're experiencing that extreme pop-up. And so now I have a lot of housing stock in my district that isn't getting freed up because people are literally feeling trapped. And so this idea that maybe there is a class or there is a specific group of individuals that we waive that pop-up so that they can move laterally and stay within our community, I think that's something that has a lot of viability and that we should be exploring. And to me, that would run counter to this specific bullet point if we would pursue that. So I would suggest that we remove that bullet from our legislative priorities.
All right, any other Commissioner Steck?
My second. Okay.
You're fine.
So just a quick question. Is pop-up and uncapping the same thing? Thank you.
Yes.
I like uncapping better. But the other thing, and I appreciate Commissioner Faber's angst about that, and I have a lot of issues that I would like to tweak as well, frankly, when I get into the details of this. And there are a lot of legislative things I think we need to drive, but we kind of do this once a year, right? And yet the rest of life takes place over the course of the year. So again, I come back to there's so much that we should be taking on, and we will be taking on either around this dais or in the conference rooms that sort of gel the reality of what we focus on afterwards. So I guess I still don't look at this as being the limiting factor for what it is that we are going to be engaged in over the course of the year. It's sort of a summary, broad statement, and to me, it's adequate. It works. I think we did a good job in trying to identify these this time around, but then just encourage we stay focused on the details as they come up during the year. Thank you.
Any other commissioners' comments, questions, or concerns? All right, I do have a motion and support on the floor. If there's no additional questions or comments, all those in favor, please say yes. Yes. All those opposed? That has been approved and will go to full board on May the 14th. Next item on our agenda is brought to us by the board office. Community Corrections Advisory Board appointment. Can I have a motion and support, please? Motion by DeBoer, supported by LeGrand. Commissioners, comments, questions, or concerns on this appointment? I'd like to thank Commissioners Bujak and Morris on this appointment. It's been one that's, I believe, has been vacant for quite some time. And we finally had one applicant, I believe that had to be a police chief, and he's out of Lowell. So I appreciate the willingness for the chief to step up and fill this role for us. Again, it's been a long time, and I just wanted to make sure that we were appointing somebody that at least we had some eyes and ears on before we made this appointment. Okay. If there's no other questions, all those in favor, please say yes. Yes. All those opposed? That appointment has been fulfilled. Commissioner comments? All right, seeing none, meeting is adjourned. Thank you so much.